Welcome to this review of Safety and Sanitation, Infection Control, a must-know section for passing your cosmetology exam. In this video, we'll cover infection control basics and common pathogens, disinfection, sterilization, and safe work practices, and client protection, bloodborne precautions, and key regulations. Mastering these concepts is essential to exam success. Be sure to like and subscribe so you don't miss future reviews, and keep an eye on the lower corner. What shows up there could give you an edge on test day. Let's get started.
Safety and sanitation, infection control. Infection control principles, bacteria, viruses, fungi, parasites. What is the primary method of preventing the spread of bacterial infections in a salon environment? Is it A, using antibacterial hand sanitizer? B, regular hand washing with soap and water? C, wearing gloves at all times? Or D, disinfecting surfaces once a day? The answer is B, regular hand washing with soap and water. Hand washing is the most effective method to prevent the spread of infections. It removes bacteria and other pathogens that may be present on the skin, reducing transmission risk. Which type of microorganism is responsible for causing athlete's foot? Is it A, B, C, parasite, or D, fungi? The answer is D, fungi. Athlete's foot is caused by a fungal infection, specifically by dermatophytes. These fungi thrive in warm, moist environments like shoes and locker rooms.
Have you noticed the code in the bottom corner? Next time you're stumped, take that code to birdsy.ai for immediate help and a free study session with Birdsy, your personal AI study partner. Plus, you'll get access to hundreds of additional questions, helping you move closer to passing your exam with confidence. The next time you're feeling unsure or stuck, give it a try.
What is the role of a disinfectant in infection control within a salon? Is it A, to kill or inactivate pathogens on surfaces? B, to sterilize all salon tools? C, to clean visible dirt and debris? Or D, to provide a pleasant fragrance? The answer is A, to kill or inactivate pathogens on surfaces. Disinfectants are used to kill or inactivate pathogens on surfaces, reducing the risk of infection transmission in the salon environment. Which of the following is a common viral infection that can be spread in salons? Is it A, ringworm, B, scabies, C, herpes simplex virus, or D, Staphylococcus aureus? The answer is C, herpes simplex virus. Herpes simplex virus is a common viral infection that can be transmitted through direct contact, making it a concern in settings like salons. How can parasites be transmitted in a salon setting? Is it A, through the air, B, via contaminated tools, C, by touching clean surfaces, or D, through UV light exposure? The answer is B, via contaminated tools. Parasites can be transmitted through contaminated tools, which can harbor eggs or larvae. Proper sanitation and tool sterilization are crucial to prevent their spread. Which of the following best describes a bactericidal agent? Is it A, an agent that kills bacteria? B, an agent that inhibits bacterial growth? C, an agent that kills viruses? Or D, an agent that kills fungi? The answer is A, an agent that kills bacteria. Bactericidal agents are specifically formulated to kill bacteria, an essential component of infection control in salon environments to prevent bacterial infections. What is the most effective way to prevent the spread of fungal infections in a salon? Is it A, using antibacterial soap? B, regular cleaning and disinfection? C, wearing gloves at all times? Or D, using UV light on surfaces? The answer is B, regular cleaning and disinfection. Proper sanitation, including regular cleaning and disinfection of tools and surfaces, is critical to preventing fungal infections in salon environments. Which microorganism is most likely to cause ringworm? Is it A, B, C, fungi, or D, parasites? The answer is C, fungi. Ringworm is a common fungal infection caused by dermatophytes, which thrive on keratin in skin, hair, and nails. How do viruses differ from bacteria in terms of infection control in a salon? Is it A, viruses are larger than bacteria? B, viruses can be killed with heat? C, viruses multiply outside the host? Or D, viruses require specific virucidal agents? The answer is D. Viruses require specific virucidal agents. Viruses require specific virucidal agents for inactivation, as they are not alive outside a host and cannot be killed like bacteria. What is the role of proper hand hygiene in preventing the spread of infections in a salon? Is it A, it reduces the transmission of pathogens? B, it eliminates all pathogens? C, it is only necessary after contact with clients? Or D, it is effective against parasites only? The answer is A, it reduces the transmission of pathogens. Proper hand hygiene is a fundamental practice in infection control, significantly reducing the transmission of pathogens, including bacteria, viruses, and fungi. Which of the following best describes the role of an antiseptic in infection control? Is it A, kills all microorganisms on surfaces? B, removes dirt and debris from surfaces? C, inhibits the growth of microorganisms on skin? Or D, destroys viruses on non-living surfaces? The answer is C, inhibits the growth of microorganisms on skin. Antiseptics are agents that inhibit the growth of microorganisms on living tissues, such as skin. They are crucial in preventing infections during minor cuts or abrasions.
If you're finding this helpful, please take a minute to like this video and subscribe to our channel for more practice exams, useful tips, and complimentary study sessions with Birdsy.
What is the primary characteristic of a virus that differentiates it from bacteria? Is it A, requires a host cell to replicate? B, can be treated with antibiotics? C, has a cell wall? Or D, is visible under a light microscope? The answer is A, requires a host cell to replicate. Viruses require a host cell to replicate, unlike bacteria, which can reproduce independently. This dependency influences infection control strategies significantly. Disinfection and sterilization of tools, equipment, and surfaces. Which of the following is the most effective method for sterilizing metal tools used in cosmetology? Is it A, soaking in alcohol? B, ultraviolet light? C, autoclaving? Or D, boiling in water? The answer is C, autoclaving. Autoclaving is considered the most effective sterilization method for metal tools, as it uses high-pressure steam to kill all microorganisms, including spores, ensuring complete sterilization. What is the recommended contact time for disinfectants to effectively sanitize surfaces in a salon? Is it A, 5 minutes? B, 10 minutes? C, 15 minutes? Or D, 1 minute? The answer is B, 10 minutes. Most disinfectants require a contact time of at least 10 minutes to effectively kill microorganisms. This allows the chemical to penetrate and eliminate pathogens properly. Which chemical is commonly used in salons for disinfecting non-porous surfaces and implements? Is it A, quaternary ammonium compounds? B, bleach? C, isopropyl alcohol? Or D, hydrogen peroxide? The answer is A, quaternary ammonium compounds. Quaternary ammonium compounds, often referred to as quats, are widely used in salons for disinfecting non-porous surfaces due to their effectiveness and safety profile. What is the primary purpose of using a disinfectant on salon tools and surfaces? Is it A, to clean visible dirt and debris? B, to enhance the appearance of tools? C. To deodorize the salon environment. Or D. To kill microorganisms and prevent infection. The answer is D. To kill microorganisms and prevent infection. Disinfectants are used to eliminate most pathogenic microorganisms on salon tools and surfaces, reducing the risk of infection transmission among clients and staff. Which of the following statements about sterilization and disinfection is true? Is it A. Sterilization removes all microbial life, disinfection reduces pathogens? B. Disinfection is more thorough than sterilization? C. Both processes are equally effective in eliminating spores? Or D. Sterilization and disinfection are interchangeable terms? The answer is A. Sterilization removes all microbial life. Disinfection reduces pathogens. Sterilization completely removes all forms of microbial life, including spores, while disinfection reduces the number of pathogenic microorganisms to a safe level. What is the primary difference between disinfection and sterilization in infection control? Is it A. Disinfection is used for cleaning, sterilization is not? B. Disinfection reduces microorganisms, sterilization eliminates all? C. Sterilization is quicker than disinfection? Or D. Disinfection is more effective than sterilization? The answer is B. Disinfection reduces microorganisms, sterilization eliminates all. Disinfection eliminates most microorganisms on non-living surfaces, whereas sterilization completely destroys all forms of microbial life. Sterilization is used for tools that penetrate the skin, while disinfection is for surfaces. Which of the following methods is best suited for sterilizing heat-sensitive tools in a salon? Is it A. Autoclaving, B. Dry heat sterilization, C. Chemical vapor sterilization, or D. Ultraviolet light? The answer is C. Chemical vapor sterilization. Chemical vapor sterilization is suitable for heat-sensitive tools as it uses a combination of chemicals and heat under pressure, avoiding high temperatures. Why is it important to follow the manufacturer's instructions when using disinfectants in a salon? Is it A. To ensure effectiveness and safety, B. To save costs, C. To avoid staining surfaces, or D. To reduce odor? The answer is A. To ensure effectiveness and safety. Following manufacturer instructions ensures the disinfectant is effective, safe, and complies with health regulations. Incorrect use can lead to ineffective disinfection or damage to surfaces and tools.
Stuck on a question? Just think of the Birdsy link in the description as your friendly neighborhood superhero, swooping in to save the day with answers. Feel free to explore it now and return to continue. Simply hit pause, and we'll be waiting when you get back.
Which type of disinfectant is recommended for cleaning blood spills in a salon? Is it A. General-purpose cleaners, B. Alcohol-based sanitizers, C. Ammonia-based disinfectants, or D. Hospital-grade disinfectants? The answer is D. Hospital-grade disinfectants. Hospital-grade disinfectants with tuberculocidal properties are recommended for blood spills, as they are effective against a wide range of pathogens, including bloodborne viruses. What is the recommended procedure for disinfecting non-porous surfaces in a salon? Is it A. Apply disinfectant directly without cleaning, B. Use only water and soap, C. Clean first, then apply disinfectant, or D. Disinfect only once a week? The answer is C. Clean first, then apply disinfectant. The recommended procedure involves cleaning the surface first, then applying a disinfectant according to the manufacturer's instructions to ensure effective microbial control. What is the appropriate procedure for disinfecting electrical tools in a salon? Is it A. Immerse in a disinfectant solution, B. Use a UV sterilizer, C. Wipe with a disinfectant wipe, or D. Rinse under running water? The answer is C. Wipe with a disinfectant wipe. Electrical tools cannot be immersed in liquid disinfectants. Instead, they should be wiped with a disinfectant wipe or sprayed with a suitable disinfectant, ensuring all surfaces are covered. Which of the following is a key factor in ensuring the effectiveness of a disinfectant? Is it A, contact time, B, fragrance, C, color, or D, packaging? The answer is A, contact time. Contact time is critical for disinfectants to be effective. It refers to the time the disinfectant must remain wet on a surface to achieve complete disinfection. Bloodborne pathogens and exposure protocols. What is the primary reason for using personal protective equipment when dealing with bloodborne pathogens? Is it A, to enhance comfort during procedures, B, to comply with fashion standards, C, to minimize exposure to infectious materials, or D, to improve communication in the workplace? The answer is C, to minimize exposure to infectious materials. PPE acts as a barrier between the worker and infectious materials, reducing the risk of exposure to bloodborne pathogens. It is essential for maintaining safety in environments where exposure is possible. Which of the following is considered a bloodborne pathogen? Is it A, common cold virus, B, C, or D, chickenpox virus? The answer is B. Hepatitis B is a well-known bloodborne pathogen that can be transmitted through exposure to infectious blood or body fluids. It is critical to follow protocols to prevent infection. What is the first step to take if you experience a needle stick injury? Is it A, wash the area with soap and water, B, apply a bandage, C, notify your supervisor, or D, seek medical attention? The answer is A, wash the area with soap and water. Immediately washing the area with soap and water helps reduce the risk of infection by removing potential pathogens. It is a critical first response to such injuries. How often should bloodborne pathogen training be conducted for employees in high-risk environments? Is it A, every 5 years, B, biannually, C, every 2 years, or D, annually? The answer is D, annually. Annual training ensures that employees are up to date on protocols and safety measures, reducing the risk of exposure to bloodborne pathogens in their work environment. Which protocol should be followed when disposing of materials contaminated with blood? Is it A, place in regular trash bins, B, dispose of in biohazard containers, C, incinerate immediately, or D, flush down the sink? The answer is B, dispose of in biohazard containers. Contaminated materials must be disposed of in biohazard containers to prevent the spread of infection and ensure compliance with safety regulations. Which of the following actions is crucial immediately after an exposure incident involving bloodborne pathogens? Is it A, apply a bandage, B, wash the affected area with soap and water, C, call emergency services, or D, take an antibiotic? The answer is B, wash the affected area with soap and water. After an exposure incident, washing the affected area with soap and water is crucial to reduce the risk of infection. This step should be followed by reporting the incident and seeking medical advice. What is the main purpose of an exposure control plan in a workplace dealing with bloodborne pathogens? Is it A, to minimize employee exposure to bloodborne pathogens, B, to document workplace accidents, C, to ensure employees receive vaccinations, or D, to provide medical treatment for exposed employees? The answer is A, to minimize employee exposure to bloodborne pathogens. An exposure control plan outlines procedures to minimize employee exposure to bloodborne pathogens. It includes training, PPE use, and post-exposure protocols, ensuring workplace safety.
Don't forget to comment below with your tips, challenges, and thoughts on exam preparation. Your experiences can make a big difference for others.
Personal hygiene and client safety. What is the primary purpose of washing hands before and after each client service in a salon setting? Is it A, to remove germs and prevent infection? B, to improve the appearance of hands? C, to enhance the scent of products used? Or D, to comply with client preferences? The answer is A, to remove germs and prevent infection. Hand washing is crucial for removing germs and preventing the spread of infectious diseases. It helps protect both the client and the practitioner from potential infections, ensuring a safe environment. Why is it important to use disposable tools or properly sanitized reusable tools during client services? Is it A, to save time during services? B, to prevent cross-contamination and infection? C, to maintain tool quality and longevity? Or D, to meet client expectations of professionalism? The answer is B, to prevent cross-contamination and infection. Using disposable or sanitized tools prevents cross-contamination and the spread of infections. It ensures that each client receives a safe service without exposure to pathogens from previous clients. What is the recommended action if a stylist accidentally cuts a client during a service? Is it A, continue the service without interruption? B, apologize and offer a discount on the service? C, stop the service, clean the wound, and apply a bandage? Or D, ignore the cut if it is minor? The answer is C, stop the service, clean the wound, and apply a bandage. Immediately stop the service, apply first aid to the wound, and ensure it is properly cleaned and bandaged. This prevents infection and addresses the client's safety needs promptly. Why is it important to regularly clean and disinfect salon surfaces? Is it A, to enhance the salon's aesthetic appeal? B, to comply with local health regulations? C, to increase the lifespan of salon equipment? Or D, to prevent the spread of pathogens and infections? The answer is D, to prevent the spread of pathogens and infections. Regular cleaning and disinfection of salon surfaces prevent the accumulation of pathogens, reducing the risk of infections and ensuring a safe and hygienic environment for clients and staff. How does wearing personal protective equipment contribute to client safety in a salon? Is it A, it acts as a barrier against infectious materials? B, it makes the practitioner appear more professional? C, it ensures compliance with fashion trends? Or D, it reduces the need for frequent hand washing? The answer is A, it acts as a barrier against infectious materials. PPE, such as gloves and masks, provides a barrier against potentially infectious materials. It helps prevent the transmission of pathogens between the practitioner and the client, ensuring a safer service environment. What is the most effective way to prevent the spread of infections in a salon environment? Is it A, regular hand washing with soap and water? B, using hand sanitizer only? C, wearing gloves at all times? Or D, relying on air purifiers? The answer is A, regular hand washing with soap and water. Proper hand hygiene, including regular washing with soap and water, is the most effective method to prevent the spread of infections and protect both clients and salon professionals. What is the purpose of using hand sanitizer in a salon setting? Is it A, to moisturize the skin? B, to reduce germs when soap and water are unavailable? C, to provide a pleasant scent? Or D, to cool the hands? The answer is B, to reduce germs when soap and water are unavailable. Hand sanitizer is used to quickly reduce the number of germs on the skin when soap and water are not available. It is an effective interim measure to maintain hygiene between client services. How does regular hand washing contribute to client safety in a salon? Is it A, it keeps hands soft and smooth? B, it helps to remove nail polish? C, it enhances grip on tools? Or D, it reduces the risk of transmitting infections? The answer is D, it reduces the risk of transmitting infections. Regular hand washing removes dirt, bacteria, and viruses, significantly reducing the risk of transmitting infections to clients. It is a fundamental practice in maintaining a hygienic environment. Why should salon professionals avoid using their phones during client services? Is it A, to prevent cross-contamination? B, to avoid distraction? C, to conserve battery life? Or D, to improve service speed? The answer is A, to prevent cross-contamination. Phones can harbor bacteria and viruses, posing a risk of cross-contamination. Avoiding phone use during services helps maintain a hygienic environment and ensures uninterrupted client focus. OSHA regulations and material safety data sheets. What is the primary purpose of OSHA regulations in the workplace? Is it A, to increase workplace productivity? B, to reduce employee benefits? C, to ensure safe and healthful working conditions? Or D, to manage employee attendance? The answer is C, to ensure safe and healthful working conditions. OSHA regulations are designed to ensure safe and healthful working conditions by setting and enforcing standards and providing training, outreach, education, and assistance. Which section of a material safety data sheet provides information on handling and storage? Is it A, first aid measures? B, handling and storage? C, exposure controls, personal protection? Or D, physical and chemical properties? The answer is B, handling and storage. The handling and storage section of an MSDS provides guidelines on safe handling practices and conditions for safe storage, including incompatibilities. What does the term universal precautions refer to in infection control? Is it A, treating all blood and bodily fluids as potentially infectious? B, using gloves only when visibly contaminated? C, sanitizing equipment weekly? Or D, avoiding contact with all clients? The answer is A, treating all blood and bodily fluids as potentially infectious. Universal precautions are infection control strategies that assume all human blood and bodily fluids are potentially infectious, thus requiring all to be treated as such to prevent disease transmission. What is the significance of the identification section in an MSDS? Is it A, lists the chemical's physical properties? B, describes first aid measures? C, outlines disposal considerations? Or D, provides the chemical's name and emergency contact? The answer is D, provides the chemical's name and emergency contact. The identification section provides essential information about the chemical, including its common name, manufacturer, and emergency contact details, which are crucial for immediate reference. Which of the following is not a requirement under OSHA's hazard communication standard? Is it A, labels on hazardous chemicals? B, material safety data sheets access? C, specific workplace layout? Or D, employee training on hazards? The answer is C, specific workplace layout. OSHA's hazard communication standard requires labeling, MSDS availability, and employee training, but does not mandate specific workplace layouts or designs. Which section of a material safety data sheet provides information on first aid measures? Is it A, handling and storage? B, first aid measures? C, exposure controls, personal protection? Or D, physical and chemical properties? The answer is B, first aid measures. The first aid measures section of an MSDS outlines the appropriate steps to take if exposure to the chemical occurs. This includes symptoms, effects, and required treatment protocols. What is the purpose of OSHA's Bloodborne Pathogen Standard? Is it A, to protect workers from health hazards caused by bloodborne pathogens? B, to regulate chemical waste disposal? C, to ensure proper labeling of hazardous chemicals? Or D, to control noise levels in the workplace? The answer is A, to protect workers from health hazards caused by bloodborne pathogens. OSHA's Bloodborne Pathogen Standard is designed to protect workers from the health hazards caused by bloodborne pathogens. It requires employers to implement safety measures and training to minimize exposure risks. In an MSDS, what information is provided in the Hazard Identification section? Is it A, details on chemical stability? B, guidelines for safe disposal? C, potential health effects and symptoms of exposure? Or D, instructions for spill cleanup? The answer is C, potential health effects and symptoms of exposure. The Hazard Identification section describes the potential health effects and symptoms of exposure to the chemical. It includes information on the chemical's classification and label elements. What is the role of engineering controls as per OSHA regulations? Is it A, to provide personal protective equipment? B, to train employees on hazard communication? C, to monitor workplace air quality? Or D, to reduce or eliminate exposure to hazards? The answer is D, to reduce or eliminate exposure to hazards. Engineering controls are methods implemented to reduce or eliminate exposure to hazards. These include ventilation systems, isolation of hazardous processes, and the use of barriers. Which of the following is a requirement under OSHA's Hazard Communication Standard? Is it A, mandatory use of respirators for all employees? B, labeling of all hazardous chemical containers? C, weekly safety drills for chemical spills? Or D, annual health checkups for employees? The answer is B, labeling of all hazardous chemical containers. The Hazard Communication Standard requires that all hazardous chemical containers be labeled with the identity of the chemical, appropriate hazard warnings, and the manufacturer's information to ensure safety and compliance.
Thanks for joining us today. If you found this video helpful, subscribe to our channel for more practice exams, tips, and tricks. And don't forget to visit Birdsy.ai for complimentary study sessions with Birdsy, your AI-powered study partner.